Today's webinar is on preparing practice-ready professionals, competency-based education for health professions. And I want to welcome you to this webinar today. So here is our webinar series team. It takes a team to put on these events for you. And I want to say thank you to the team and to everyone who's worked hard to make this happen today. We do have live Spanish interpretation today. Aitana is a live human being, not AI. And if you'd like to hear the Spanish translation, you can select the circle that says more at the bottom of your screen, or you may see a globe icon, and that will allow you to select the audio channel for Spanish translation. So thank you to Aitana, who will be translating for us today. We appreciate that. This webinar is hosted by Lecturio. If you'd like to learn more about Lecturio, you can use the link in the chat or scan the QR code that you see on your screen. And at the end of today's webinar today, after the hour, if you'd like to stay for a demo of the Lecturio platform, we'd be happy to provide that to you. I'm your host. My name is Sarah Keith. I'm the Director of Learning and Institutional Success here at Lecturio. I want to introduce to you today our guest speakers. We are so honored to have Jacquelyn McMillian-Bohler. She's the Associate Professor and Associate Dean for Academic Innovation and Evaluation and Director for Educational Excellence at Duke University School of Nursing. So we're so excited to have Jacquelyn with us today, as well as Charla, who is the president of the Competency-Based Education Network. So welcome, Jackie and Charlotte. We are delighted to have you here today, and I'll turn it over to you.
Thank you, Sarah. We are just very excited to be here, and it's very exciting to see everyone from all over the world. Charla and I have an opportunity to speak to lots of colleagues from across the United States, but today we have an international presence, and that feels really great. So we know that we have some, and I can't tell from the chat if everybody is nursing, but maybe not. And so we want to assure you that we'll be using nursing as an exemplar, but we do feel that everything we're presenting today, you'll see the crossover regardless of what healthcare profession you represent. So Charla, shall we go?
Let's do it.
Let's do it. Okay, so the title of our talk today is Competency-Based Education in Healthcare, Preparing Practice-Ready Professionals. Sometimes we get a lot of feedback about the idea of practice-ready, or our graduates practice-ready. If you need to change that around to ready for practice to make that feel more accessible, that is totally okay. But know that our goal here is to make sure that our graduates are ready for the world that is facing them when they leave us. Okay, next slide, please. So one of the things that is critical, and you'll hear Charlotte talk about this as she gets into the process a little bit later, is that we have to clearly define what we want people who participate with us, learn from us, learn with us, should be able to do by the end of the presentation, by the end of the unit, and all of those things. So we would not be providing a good example of competency-based education if we did not talk about our goals, which are our three objectives that we have. So first, we're going to define the core principles of competency-based education and really what the application is for healthcare programs. So why do we need to know this thing and do this thing called CBE? We're going to illustrate how CBE is implemented in the nursing discipline as a model for other health professions. So you'll hear us talk about nursing, but we will also allude to how that might translate into your professions as well. And then finally, we're going to explore some strategies for designing, assessing, and supporting learner progression toward professional competence. Now, we only have about 40 minutes, so we're not going to dig down deep in this, but hopefully we'll whet your appetite for more, and maybe you'll come back to Lecturio for further development and further questions. Next slide, please. So let's talk about our objective number one, to define the core principles of competency-based education and their application in healthcare. Now, I could go there, but I need to make a case. I need to make a strong case, because one thing I have learned through working with faculty is that this is a change, and change is hard. And we don't like to do anything unless we understand why we're doing it in the first place. So let's do that. Next slide, please. Let's maybe adapt this objective, and we're going to say, why do we need to implement CBE in the first place? So I'm going to talk about nursing for a second and what goes on in the United States. So next slide. we have a board exam. All of us do. All health professions have some kind of board exam. But for nursing, we have in the United States, the National Council of State Boards of Nursing give a board exam called the NCLEX. And our first time pass rate for this NCLEX in the United States was 91%. 91% sounds pretty good. So if this is the minimum standard for practice and we have a 91% pass rate, then that sounds like we're doing perfect and everything's great. Let's talk about the rest of the story. Next slide, please. So we have estimates that 900,000 nurses in the United States are going to leave the profession by 2027. And considering we only have 5.3 million practicing in the first place, there's a staggering statistics that is saying something is wrong with this process. Why are nurses leaving? And you might be thinking, oh, well, retirement. People get old. They leave the profession. That makes sense. Let me share another slide with you. Next slide, please, Charla. So when we look at this report from the National Healthcare Retention and RN Staffing, if you look closely at this graph, and click it one more time, Charla, what you'll notice is that the nurses who are leaving, when we think about how long they've been in practice, are the nurses who've been in practice for less than a year. So they've gone through all of the work, the study, the money, the time, the effort to become nurses, but there's something about what happens once they get out to the field that's not sitting well with them and they're leaving to go find other jobs. So again, pointing to an issue. We have a test that may not adequately demonstrate that our learners are ready for the work. We have some data that says they don't necessarily like it once they get there. And we have some challenges that we need to address. Okay, so that's thing one. Are they prepared? So let's talk a little bit about how we typically prepare them. Next slide, please. So when we develop objectives, and many of you may or may not know who this gentle person is, but this is Benjamin Bloom. So you may have heard of Bloom's taxonomy as you develop your learning objectives for your courses. But this is the person who we have, or who has the name of Bloom. But it was actually a team of people who developed Bloom's taxonomy. So it was Bloom et al. Who developed the taxonomy that we use that you see here to the right. So next slide, please. So let's look closer. So we have these verbs: remember, understand, apply, analyze, evaluate, create, that really speak to how our learners are going to perform at the end of a course, at the end of an assignment, at the end of something. And these are great verbs, but they all reside within the cognitive domain. And so when we think about planning activities and writing objectives, all of us in the health professions are in the job of doing something. Absolutely, we know things. That is critical, but that is not the entire essence of what we do. We do things. And so in order to prepare our learners for what is coming ahead, we have to make sure that they don't just know, but that they can do. So what competency-based education, next slide please, Charla, is geared towards is bridging this gap between knowledge and action, because right now we're stumbling a little bit. So if you look at some of the data on failure to rescue, so in looking at things that happen that are unfortunate in the healthcare setting, when we don't respond as quickly as we should, and we have poor outcomes, when we debrief the people who were a part of that event, most of the time they know what should have been done. They just didn't do it. And so is that the way we want to educate and set our learners up as they graduate to really only be focused on knowledge? Or do they need to be focused on the action that goes with the knowledge? Next slide, please. So I'm going to give you a different pyramid to look at, and this is Miller's pyramid. I'm actually going to give you another one after that. So this is 2 of 3. So in this pyramid, what we're looking at is specifically what our person does. So this is Miller's pyramid of clinical competence. And you'll see the same sort of evolution, the scaffolding of learning, but knowing things is at the bottom, right? It occupies only a fourth of this triangle, not the full triangle. So knowing is at the bottom. Knowing how we interpret that information moves us up the triangle. Showing becomes really where we want to get to. How does the learner demonstrate what they know? And then finally, as an expert, as we move into practice, that they're doing these things and they're doing it independently. They're performing the activities. What would happen if we change the way that we focus our educational experience around making sure the learner can show us, perform it in a real life practice setting? What would that look like? Next slide. So that's where we sit. How do we move our learners from showing us what they know in a multiple choice exam to actually demonstrating it? So not necessarily in a case study, but in a real life situation. What would that look like? Next slide. I give you one more final triangle to think about. And I lifted this actually from the business literature. So it has nothing to do with practice per se, but look at what's in here. So knowledge, again, occupies a small part of the triangle. But when we think about skills, we're not talking about taking care of a patient with a certain diagnosis or doing any of those things. We're talking about skills around goal setting, time management, reasoning, communication, interpersonal skills. Do those matter in practice? Absolutely. Doesn't matter which practice you're in, they all matter. And when we think about attitudes, self-motivation, confidence, integrity, honesty, those are attitudes that absolutely impact our practice. Okay. So thinking about what that looks like and how we teach, and more importantly, how do we hold our learner accountable for it becomes a critical element in what we're doing. So let's look at the definition of CBE. CBE, and this is according to the American Association of Colleges of Nursing, it is a system. So not just a one event, a system of instruction, how we teach, how we assess them, how we provide feedback. And many of us in health professions, education, don't have a background in actually learning how to teach. Feedback is the most critical element of what we do. It's how we get better. And it's something that we're not all that great at doing. In order to implement CBE, though, we have to learn how to do it and do it well. We have to make sure that our learners can self-reflect because, again, that's how they improve. If they don't know that they don't know, then as you all know, that's the worst situation ever, right? They have to be able to move beyond taking courses as a demonstration of what they know. They have to be able to provide exemplars for how they have specifically demonstrated behaviors that are consistent with practice. And that word that is highlighted, demonstration, that has to be the key to what we do. They have to demonstrate they have the learned knowledge, attitudes, motivations, self-perception, and skills, which is a slightly different way of thinking. So I'm going to put up the first poll now and ask a question for all of you. We can slide up poll number 1. So now that I've talked about what CBE is, how familiar are you with it? Looking good. Well, our colleagues that are very familiar might have to reach out, put you in chat so we can reach out to you, and we're looking for other experts to come help us talk about this topic. This is great. Thank you for sharing. And this is where we're getting to in nursing, especially about our comfort level with CBE. Sometimes our not very familiar at all might have more than one person in our conversation. So thank you for sharing this. Okay, next slide. So let's talk about some of the key differences with CBE. And for those of you in the not very familiar and not familiar at all, this is for you. So when we think about our primary goal in competency-based education, we're getting back to that demonstration of skills, right? As opposed to a traditional way of learning where we are measuring what our learners know at a one particular set point in time. They have an assessment on this day and this time, and I just want to test you here on this day. I am not necessarily testing you on your ability to apply this concept in multiple situations over time. There's flexibility within competency-based assessments. It is highly adaptive because we are really working on an individual learning experience and making sure that our learners test when they are ready, versus in the traditional assessment framework where our testing is rigid. Everybody's on the same timeline. We test on Monday at 3 p.m., ready or not, here we go. And sometimes learners are not ready, not because they can't do it, but just because they weren't ready at Monday at 3 o'clock, okay? The timing of the assessment, we think about frequency. Do we just test Monday at 3 o'clock, or have we been testing them all along so that when we get to that point where they're ready to do their final assessment, they've done it so many times, they're like, yeah, of course. Sometimes, I don't know if you've had this experience, but my colleagues certainly had, everybody's nervous going into an exam. don't know how this learner is going to do, don't know what this is going to look like, everybody's a nail biter. If we're doing that, that means that we're not necessarily setting our learners up for success. We want to make sure that we have frequent assessments, that we are providing formative assessments for learning so that by the time we get to that final assessment, everybody is ready. We think about student support. We think about coaching our learners towards success and not just teaching. Remember, learning is a very individual experience that people have. Can't make someone learn something. So our job is to coach and provide feedback so that we can move them forward. Traditional assessments are more competitive in nature. We're focused on the grade, like that 91% pass rate. That is not the full picture of the readiness for practice that we hope to establish with our learners. When we think about CBE in terms of emphasis, we want to think about deep learning, our ability to use what we've learned in lots of different situations that are very practical versus a traditional assessment method, which is based on memorization and short-term recall. And what does that look like? Colleagues, that looks like when you have a student from a previous semester who says, we did that last semester, right? Or I know we did it at the beginning. I don't remember it now. And the brain, we call it brain dumping in the United States, where I learn it all for my exam, but then the next day after the exam, I can't remember any of it. And that's not the way we work. We are training people to take care of other people, and they're going to need a wealth of information that they can pull from in order to do that successfully. Next slide. So CBE increases engagement because the learners have to be involved. It increases readiness for practice because we are actually making sure that they're able to demonstrate the skills they need in practice. It allows for us to do that person-centered, individualized teaching because we're assessing and working with our learners closely, and it is transparent. No sneaking, no scaring, none of that, because you cannot learn when you feel like you're always on point. You can learn when you are relaxed and you feel like you have the support of your instructors and your faculty behind you. That is the way that that works. Next slide. So CBE can be the way that we bridge the gap between knowledge and action, and we can help create success, right? Rather than the stumble. Okay, next slide. So competency-based education is not checking off a list of skills. Skills checklists might be part of the way that you learn, but that is not CBE. It is not administering a one-time, one-and-done assessment. It is not evaluating behaviors in an isolated single scenario. It is not ignoring the things that are going on around us in the world, the politics, the life, what is going on, and how do I use this information in a real life situation. It is not just completing a course. Taking a pharmacology course is not the same thing as knowing how to use the pharmacology information. It is not allowing unlimited times to just complete something until they get it right. That is not CBE. It is not just streamlining your implementation. It takes a lot of work. CBE is a very complex pedagogical style. So making sure that we learn just basics around course building is going to be part of the process of CBE. And it's not just sort of tweaking a few things, saying that this is going to get it right. There's more to it. Okay, my last slide. Go ahead, Charla. In terms of process, these are the things that in nursing we are doing to move forward competency-based education. And Charlotte's going to explain a lot of this as we go forward. So I'm just sort of warming you up to be ready to listen to this next part. So we're going to define performance-based practice behaviors. Again, getting to that transparency. What does it mean? What do we expect the learner to do? We're going to align those behaviors with the outcomes of our program to make sure that we have a target that is clear to the faculty, to the learners, to everybody that interacts in that process. We're going to analyze our curriculum to make sure that the objectives that we have in our courses actually align to our outcomes. And then we will likely find that they don't all align the way that they need to, and we're going to update not only our courses, but thinking about our course descriptions and the objectives that we have to make sure that they actually reflect what we want the learner to do. We can align and cluster our evaluation strategies so that everything is not one for one, because we don't practice one for one. We practice groups of skills together, and so we want to test that way because that looks like real life. We want to align our learning activities with our assessment so they are not just hanging out there as an activity of entertainment, but they actually serve a purpose in preparing for exams. And then we want to make sure that we have a way to help the learner track their progress. That is a key to engagement. We have to make sure that they feel responsible forgetting the things that they need, especially when they know what those are, because our performance indicators and our objectives are written in a very, very clear way. All right, Charla, how do we do it?
Thank you, Jackie. I appreciate you laying the groundwork here. Did you have a second poll you want to do, or you want to just wait on that? I wondered if you
Yes,
wanted to
I
do
do.
it.
Yes, can we release poll number 2? I forgot about poll number 2.
That's okay. I just thought I would give you that opportunity.
You. So let's see
Yeah.
how well we did with this information I talked at the beginning. So read through these. What is our primary goal of CBE? And you can change your answer if you feel some peer pressure. That's okay.
Wouldn't our students love this if they could just, as they're doing a pen and paper test, like, oh, if I only knew everybody else was ranking it.
Yeah. Okay. All right, so remember, when we're utilizing CBE, we're testing students across a continuum. So it's not just one point in one day. It's what can they do on Monday, Wednesday, Friday, 2 weeks from now, a year from now, right? So we want to think about the continuum of learning, the continuum of actually being able to perform it, and not just one specific time. So great job. All right, now it's yours.
All right, perfect. Well, hello everybody. I'm always delighted to be with Jackie. She and I are getting ready to get on planes and head to the state of Washington to do some training there at the end of the week. So it's always a pleasure to get to present with Jackie. For those of you who don't know CBEN, CBEN, the Competency-Based Education Network, is really an international leader in helping to build learning systems that connect education to workforce needs. And though we are backed by a global network of federal government, state agencies, accreditors, colleges, and employers, we really work in all industries. And over the last 18 months to 2 years, have been working with AACN in the United States, as well as medical colleges, chiropractic schools, physical therapy programs, lots of healthcare programs to really think about this shift from a traditional model that's more focused on inputs to one that's focused on outputs or the outcomes. What can a learner do? One, I appreciate Jackie sharing AACN's definition of CBE. It's probably a little different than mine. But what I'd like to be able to focus on is this definition around a competency. So what is a competency? We keep talking about, do they have the competencies? Do they have the knowledge, right? That's the book smarts. Can they recall a theory? Can they be in a situation and say, oh, that's X, and that means I need to think about Y, right? Do they have the knowledge, those theories, the big ideas? Do they have the skill and the ability? Can they take that knowledge and actually do something with it? But we also include, do they have the right behaviors? Do they have the right dispositions? You have probably had an engagement with a healthcare professional in which you felt like you were processed, part of an assembly line. You came in, they just did your blood pressure, they did your temperature, they took your weight, and they moved you to a room. And then the next person came in and they did their little thing, and then the doctor comes in, and there's not a lot of engagement about who you are, what are you experiencing, what's going on in your life that might be causing it. It's very mechanical, very routine. They often lack the kinds of dispositions, the kinds of behaviors that we would want them to have as a health professional. So we focus on knowledge, skill and abilities, and the dispositions, the behaviors that one is going to need to have if they're going to be successful in a given context. So if you're here from a medical school, if you're here from a physical therapy program, if you're here from chiropractic, nursing, whatever, same thing. What do they need to know? What do they need to be able to do? And how do they need to behave if they're going to be successful with whatever credential it is that you award? The key is about mastery of those competencies. So if we say for your medical program, these are all the competencies that go in it, the knowledge, the skills, the abilities, the behaviors, we are saying our graduates have each and every one of those competencies. In the morning, I'll be boarding a flight. I want to know that my pilot went through a CBE program, right? In a traditional program, you might be able to get away with knowing 70% of the content and still passing the course and progressing. But you tell me, what 30% of piloting are you okay with them not mastering, right? For a nurse, for a doctor, for your specialist, are you okay if they only knew 70%? Probably not. That's why CBE makes so much sense. We want to make sure they know all of the steps. Recently, in August of last year, a pilot took off from an airport in, I think they were in Oregon. They took off from an airport in Oregon, headed to San Diego. They're in flight. And all of a sudden, the pilot realizes they do not have the competencies to land the plane at the airport they were scheduled to land at. And the pilot literally came across the speaker and said, "Ladies and gentlemen, we have just discovered that I don't have competencies to land in San Diego. We are going to be diverting to Phoenix, Arizona, where I can safely land the plane, and another pilot is coming on to take you to your final destination." Thankfully, the pilot realized the lack of competencies before trying to land the plane. But do your learners know that? Do they actually think I'm competent because I had a 91% pass or because I got my license? I must be really competent. Are we sure? Do they know each and every? So that's the benefit of a CBE program. All CBE programs are built using a backward design model. So Wiggins and McTighe really popularized this in 2005, but it goes back to work that Mager did in 63, Tyler in 49, and even all the way back to Charters and Bobbitt, an early learning theorist of the 1900s. They all said, to start the learning process, we begin by saying, what is it we want our learners to know at the end? Not what are the inputs I'm putting in, but what do I need my learners to be able to know and do at the end? And if we start with that end in mind, if we start with what the outcome should be, then we can literally build out a program that will get them to, I know how to land the plane, I know how to fly it, I know all the steps of that, right? So we start by saying, what does that end result look like? So step one in any CBE program, if you're going to do this in your academic discipline, get clear on what it is. If someone's graduating with this as a credential, what is it they need to know? What do they need to be able to do? And how do they need to behave if they have that credential? So we start there, get very clear around end results. There are a lot of ways you can do this. You can take your current courses, break it apart, rebuild them after you figure out what those outcomes were. Sometimes that works. Sometimes you just rebuilt a kind of crappy program and now a competency-based way, just to be candid. So for some, we use a framework origin. Could be that in your academic discipline, in your professional area, there is already a framework of competencies that someone needs to know, be able to do, and how they need to behave. If so, leverage that. And if you have nothing to work from based on the country that you're in, maybe you don't have a national framework around competencies, then start by creating one. pull together your practice partners and say, what is it you think a graduate needs to know and be able to do? Bring your faculty with the expertise to help refine that list of competencies. And still, where you can, right? There are lots of competency sets out there. So think about, how can I borrow someone else's framework? How can we modify that for our own nation or in my own state? AACN, for the nursing profession in the United States, they actually created a framework, and they have these big buckets of competencies. They call them domains. There are 10 big domains. Inside each domain, there are actually a set of competencies. These are pretty big, broad statements. They apply to whether it's an undergraduate program or a graduate nursing program, big statements of competency. Then it goes down another level and says, these are the sub-competencies. This is what that competency looks like at an entry level, right? At that more basic nursing level. Here is what it looks like in an advanced practice level of nursing. So they took their big competencies, they broke them into sub-competencies where they began to describe what it looks like kind of at a credential level, but really at an entry level credential versus an advanced level program. And today, they've even come back in with some more granularity to help to say, all right, if you say somebody has to demonstrate compassionate care, what does that look like? What should a person do? And they call those progression indicators. So they're pictures, they're actual things I should be able to see a learner do to know if they are on track for being able to master all the competencies at the point of graduation. So those progression indicators are truly based on discrete descriptions of what a learner should do. What does the compassionate care look like? If I close my eyes and thought about somebody who's being compassionate, what are they doing? How's their tone? How's their therapeutic communication? What's their touch like? What is the way in which they're referencing you, right? They're talking to the patient. We're going to describe what that looks like in a behavioral based way, not a cognitive way. Jackie does a great job of bringing in Bloom's taxonomy, but Bloom's is a cognitive model, right? It's about the way we think. And I need him to translate thinking to doing. So what does it look like when they're doing it? I often tell the story. I had 4 kids in 5 years. And when I would take them grocery shopping, people were always like pointing at me like I stole them at various aisles along the way, right? They're all mine. But oftentimes my kids weren't the best behaved. I might have said before we got out of the car, please make sure you behave while we're in Walmart or we're in the grocery store today. And then when we get in there, they may be running around the shopping cart or getting stuff off the shelves and putting it in our cart. They might be pulling their little brother's sock or what have you, right? They didn't realize they weren't behaved, but my statement was so broad, let's behave. They don't know what my expectations are. So I've got to get clearer. Please make sure you pick up nothing while we're in the store and put it in the cart. Please do not talk above the level mom is talking right now. Please don't get out of the buggy or the cart or whatever you call them in your country. Please, whatever it is, if I'll describe what I'm looking for, my learners and my children can measure up to expectations. So that's what CBE does. Here's an example. Instead of saying 2.1, that's a competency up at the very top. Engage with the individual in establishing a caring relationship. Oh, that's beautiful. But what does that mean? What does that actually look like? And so we break that down and we say, all right, if you're going to establish a caring relationship, one of the sub-competencies is 2.1a. demonstrates qualities of empathy. All right, so I've got to be empathetic. What does empathetic mean, right? So now AACN has released progression indicators. It means you listen to patients. You can pick up on their verbal and nonverbal cues. You use simple, person-centered language when you're explaining what you're doing. Don't give them the big Latin phrase for what you're doing. Talk to them in words they know and understand. That's showing empathy, right? When they've met our needs for an entry-level nurse, they should be able to anticipate a patient need. They should leverage those therapeutic communication skills. They should ensure patient preferences are being revisited because somebody may change their thoughts about how they like to have care delivered once they have a diagnosis, right? They may have a different way they want you to talk to them or to approach them. So this is a framework. We're getting clear on what our outcomes are, what that end result needs to look like. So step 2 then, once you're clear with end result, go to step 2. How are they going to show it to me? Most of the time, we don't do our assessments until after we've taught whatever we were going to teach. In CBE, we do our assessments first because we know what the end result is. We should know how they should show it to us. Does that need to be a role play? Does that need to be a clinical experience of some sort? Do they need to do that in a case study? Do they need to do it with diagnostic notes? What do they need to do to show me whatever those behaviors are? So we start by figuring out what's our assessment method. How do we do that? Let's look at the verbs. If it says you listen, you use, you document, you anticipate, you respond, I don't do that in a multiple choice true false exam. We love our little bubbled exams where we can color in an answer, but that is not doing. That's knowledge acquisition, maybe, but it isn't doing. So if I have to listen to a patient, I need to put them with a patient. I need to put them in a role play where they're actually having to listen. They're actually having to use cues. They're having to anticipate or having to respond. So we use our progression indicators to say, what do we say a learner has to do? And how do we connect our assessment method to the actual doing of that competency? So that's step 2. Figure out your assessment method and what actual assessment would you give. Pre-write those before you teach the course. It keeps you on track as a faculty in making sure that you stay focused on the things you actually have to teach. Once you know where you're going, step 1, once you know how you're going to assess, the third step then is to say, exactly what am I going to need to teach in order to get a learner to that performance? I don't know about you. I'm a lawyer is my background. I taught law. And so there were a lot of times that I loved to teach things in the law that I found unique and interesting. It's kind of interesting. I'm a theme park lawyer, so I work with theme parks and amusement parks. And so for me, I love to talk about roller coasters. But most of my students, if not all, will never work in the theme park business. So just because that's like what I want to talk about, that is not going to get them to the performance they've got to be at on that final summit of assessment. It's not going to get them to the end result. So by knowing the end result, by knowing how I'm going to assess, I can say to myself, you know what, that little story about the roller coaster, I got to leave that one out. Instead, I actually need to focus on this piece of information because that's what they really need in order to be practice ready. So in most CBE programs, we pre-write that curriculum. We literally go through that curriculum and write out, what are we going to talk about? What are we exposing them to? So that we have everything pre-thought through. We don't want to leave anything up to chance. And that's what makes CBE a very unique experience. I'd like to just digress 1 minute. One thing I know I did not say that I wanted to say here, this last bullet about assessments being performance-based is key. And I think I hit on that. They've got to actually do whatever those verbs are on the next sheet. The second part of that is they should be criterion referenced. On that, let me point out that when we set our expectations in advance, this is the assessment, and here is how I want you to perform on that assessment. We then hold that criterion, we hold that rubric constant, and we take each learner and evaluate them against that rubric. How did this learner do? Did they meet expectations or not? We are not curving grades. We are not saying, oh, I had no one that met expectations, so let me change my expectations. No, I've got to go back and remediate to get learners to my expectation. We must hold the learners constant, or you will have a pilot who does not know how to land the plane. You will have a nurse that does not know how to insert a catheter. You'll have a doctor who does not know how to perform a procedure, right? We must hold our criterion constant and evaluate that learner against that criterion. And then the last word here is authentic. It should mirror as closely as possible what it looks like in practice. I'd love for that to be done in a true clinical setting, but you may not have that luxury, right? And so we want to get as close to possible as we can, get it as authentic of an experience as we can. So I didn't say that, and I missed that. I wanted to go back and say that's a really important part. Those are the 3 steps. And when you have gone through the getting clear on results, setting your evidence, and then planning what you're going to teach, how you're going to teach it, what your curricular priorities are, now you can begin to implement that curriculum and then monitor your learners to make sure they truly are practice ready. Not by a minimum standard of a licensure exam, but a bedside standard. Do they, in fact, show up practice ready in the environment? So with that, I think we did a good job of sticking to our 45 minutes. Jackie and I are willing to take questions, and I think our team at Sarah is going to help facilitate that Q&A process. So Sarah?
Excellent. Thank you. Thank you so much for that presentation. I know I learned a lot about competency-based education, and I really appreciate you sharing that with all of us. And I want to remind everyone that if you have a question that you would like answered, I do have some already, but if you have another question, please place that in the Q&A box, or you can put that in the chat. In either one of those places, we will see it, and we will try to answer all of the questions that we can. One of the first questions I'd like to ask you, and I'm going to let the 2 of you decide who answers which question. So first question is, in healthcare education, how do you ensure, when you're doing competency-based assessment, how do you ensure that that remains authentic to the clinical realities while still trying to maintain fairness and consistency across multiple assessors, multiple faculty members, multiple classes?
I can take that one. The first part of the question, in terms of making sure that it's authentic, one of the things that we miss often in some of our helping professions, even if we're involved in active clinical practice, is making sure that what we bring into the classroom really reflects what's actually happening out in real world, and breaking that down. And so for those of you that are in active practice, you certainly see it, But if you're not working with new learners or new graduates, sometimes you still don't even see it the way that they see it. So making sure that that part of the team who's developing those assessments are made up of people who are actually dealing with that issue in real life, so that it looks like that. That's one of the ways to maintain authenticity. And also, we have to open our horizon to what we think about assessments. Most of us were brought up with a lot of the paper, pencil, multiple choice, and that's our go-to. So we have to be willing to take that leap and say, what are some other ways that I can assess the learner so that I can actually see them, in practice? Maybe I don't have a fancy mannequin and I can't do that, but there are lots of other ways that we can engage learners with role play in the classroom, that that we can do simulation in situ in the hospital facility if we talk to our practice partners about what our needs are. Now, they might be resistant to that if you come and say, hey, this is what we want. Can you help us do it? But if you say, hey, we're trying to develop a program here, is there anybody from your clinical education department that would love to sit down with us as we think about how to design this particular assessment? You get a lot better interaction and a lot better move forward with that. And then second part of the question, Sarah, remind me.
It had to do with fairness across multiple assessors.
Okay. Charla, you want to take that part?
Yeah, I would
Yeah.
love to take that one. So when we think about reliability and validity of an assessment tool, right? So a couple of things. One, I think you want to be really intentional that every learner faces the kind of consistent, we call them hit and misses. So if a learner does this, this is the way the standardized patient should respond. If the learner does this, this is the kind of way the standardized patient. So we write those in advance. These are planned, two things, planned challenges every learner will encounter in the experience. So think through, what are those consistent planned challenges? So if you're having a role play in class, whoever is playing the part of the patient knows what that planned challenge is going to be that they've got to put in there. And then they have the hit or miss behavior that says, if that my fellow classmate does this, I need to respond like that. So that's one part. Use plan challenges, hit miss behaviors. Second is, where you can, record them, watch them back as a learning experience to see, do you have variation from faculty member to faculty member? Are we scoring them consistently? Usually, if we're going to release a new assessment tool that's a pretty advanced assessment, role play as an example, we're going to work with faculty. We're going to practice that. We're going to have some mock learners. We're going to have them score it. We're going to go back in and look at the consistency in the scoring from one faculty member to another. We're going to talk about, why did you give a 4 and I gave a 2? Why did you think this? So that we can calibrate on our scoring before we administer. But it's also good to do that after you administer. Can we randomly look at a couple that you did and a couple that I did? Could we cross score them? Would we have come out the same? That's all your quality improvement, right? Your continuous improvement to make sure that you do have that fairness from one faculty member to the next.
Excellent. Thank you so much. We have another question that's about what are the major differences between outcome-based curriculum and competency-based education?
I can start, Charla, and maybe, or you can go ahead.
No, go ahead, Jackie.
Okay. So when we think about outcomes, it's not, I think we get into trying to slice and dice the words. And we think about competency-based education, there are outcomes that you are looking for, and you are defining those outcomes, and you are saying what they are. When we think about CBE, what we're saying is are those outcomes that we are trying to measure consistent with what practice looks like? So if you set up your program outcomes, which we all have, do your program outcomes mirror what it means to look like an individual who's out in practice doing a great job? So that's really what it is. So if your outcomes are based on practice, then you do have potentially the start of a CBE program. So making sure that those outcomes are aligned with authentic situations that exist in real life for your learners will create an opportunity there. Charla, do you want to add?
And that you hold them to meeting that outcome in order to earn the credential. That would be, to me, where the big difference might be. If your outcomes-based model says all learners must meet these outcomes in order to earn credential, I'd say they're pretty similar. If yours says these are the things we aspire to teach, the outcomes we aspire for a learner to get to, but you don't hold them to the actual demonstration of those, that would be, for me, the big divergent between the two concepts. Sarah Keith?
Excellent, thank you. We do have a few more really excellent questions, and so if you don't mind answering a few more, I'll share them
Absolutely.
as well. What is the strategic role of milestones in guiding learning progression and assessment within CBE frameworks?
Okay, I'll start, and then Charlotte, back me up maybe. So we think about that the whole idea with backward design is that we know where we're going to end up. And when we know where we're going to end up, then we can begin to set what are the anchor points. And sometimes this is about scaffolding. So we use that word in curriculum design all the time, where we're actually building up our curriculum. So you might decide that in order for a learner to be able to achieve X by the end of the program, there are some points along the curriculum where we have some stop off points where this may signal a learner is falling behind. And that doesn't mean they fall behind and they're out. It means they're falling behind, and we need to get around that learner with extra supports in order to help them move forward. So helping to identify where those points are as you design your curriculum helps you kind of create those points so that the learner is not getting all the way to the end of the program and being told you're not ready to go. That we have these goals, because these small bite goals actually motivate us to move forward. So setting those milestones is really critical in terms of those formative assessments that help you know that the learner is progressing. Not only lets you know, but also lets them know. And then if there's issues, you can address them sooner rather than waiting until the end. Charla?
And these progression indicators I pulled back up on the screen, right? So developing is a milestone. This is by midpoint in the curriculum, they should be able to do the things at developing. If they're not, we need to remediate right now before they keep going on. Developed is where are they going to be by the end. So those progression indicators do lay out the kind of the progression that you would expect as a learner is building their skill set, and use them as milestone. Remediate if they're not hitting those milestones. That, I think, is the key. Oops, sorry.
Another question, and this person's question is about how MCQs might be integrated. So can we use OSCEs with scenarios to mimic a clinical situation to assess a competency-based education with MCQs? And this person notes, I noticed your strong guidance on MCQs, which I thought was a wonderful way to say that. But are there ways that MCQs can still be useful in competency-based education?
And Sarah, just for everybody, MCQs stand for
Multiple choice questions. Thank
okay,
you.
Thanks. Yeah. Okay. So, multiple choice questions are useful. There's nothing, Charlotte and I are not saying you should never use a multiple choice question ever, because also you're also training your learners how to prepare for an NCLEX exam or some kind of board exam. And often those are multiple choice questions, and we need to prepare them for that as well. But it's just making sure that multiple choice is not your only way that you're assessing someone's competency. It might be a way that you're assessing some elements of their knowledge because that helps build towards competency, but you're not saying that because you pass this multiple choice test question that you are now ready to go out and care for a patient fully. That is not what it means. So use it as a part maybe of your formative learning aspect to say, do you have the knowledge so that we can then build on this and go forward? Absolutely. Use it as a check-in in class, use it as a check-in for a unit, but don't let that be your only measurement, right? So it's knowledge, skills, and attitude that makes up a competency. Make sure that you're using something that's consistent with those other aspects of the triangle, which a multiple choice test will not capture.
Nothing to add. Great job.
And this next question is a little bit of a blue sky question. So about AI. So how would you like to see advances in AI and hybrid learning being used for competency-based education?
Go, Charla.
There are lots of ways, right? I think there are ways that AI can be used to truly personalize learning. So you guys talked about progressions, you asked questions. So if AI could get in and look at how a learner performs specifically and be able to say, ooh, alert, this learner is not on track. They've not hit milestones, and it opens up for them new content. It goes back in with new questions. It helps prompt them. I think AI can help empower personalization of learning like we have always wanted, but had a really hard time achieving. So I encourage AI with learners in a lot of different ways. I think there are some AI apps that could be helpful, even mental health wise, or check-ins, or making sure that your learners are in fact engaged. And if they're not, are they okay? And how can we leverage that? For faculty, all this work we just talked about, AI can help carry some of the lift of doing some initial drafting. So when Jackie and I do workshops, for example, we teach people how as faculty, could I use AI to help me draft behavioral based progression indicators? What would that look like? Or how could I take all of these progression indicators I need to teach in my class and create a role play in 20 seconds that would then allow them to show all of these various behaviors. So AI can be a great friend to you too, as you're trying to implement CBE. So I think it helps both the learner and I think it helps you as a faculty as well.
Yep, agree.
Excellent. Thank you. And I hope that if anybody's interested in learning about some really specific applications of AI and those things, stick around. We didn't pre-plan that question in advance, but it is a really great lead in into a Lecturio demo that's coming up next, where you can see some features like automated remediation and also AI assisted lesson planning. So that is a great transition here. I want to once again thank our speakers, Jacquelyn McMillian-Bohler and Charla Long, for this incredible presentation that we've had today on competency-based education. And just thank you again. That was really wonderful. I learned so much, and I saw some wonderful comments in the chat as well from everyone who enjoyed this presentation and who really appreciated everything you had to share today. So thank you for that.
Pleasure. Our
And if we
pleasure.
didn't get to anyone's questions and you have them, you use our emails and reach out. We'll be happy to follow up if we didn't get to your question.
Absolutely.
Excellent. Thank you. And so once again, this webinar was brought to you by Lecturio. If you're interested in learning a little bit more about Lecturio, if you have the time, you can stick around after the presentation today for a demo. If you'd like to schedule that at a later time, there's a link in the chat, or you can use that QR code that you see appearing on your screen. We have a product called Healer, which is beneficial for clinical reasoning training. It is a virtual patient simulation. So if you're interested in that, you can scan that QR code, or again, a link will appear in the chat for you. And for those of you who have asked, we will share the recording in an email. And so you'll see an email in the next day or so that will have a follow-up survey included. I'd love for you to complete that. If you need an attendance certificate for today's webinar, you can indicate that on the survey, and that will generate a certificate for you. So if you need a certificate, once again, watch for the survey in your follow-up email, and that will give you the option to request it.
Absolutely.
If you're interested in more of these webinars, we're always planning what's coming up next. So in November, we have the Future of PA Education with Tony Miller. He's a fantastic speaker. If you are at all interested in PA education, I would strongly encourage you to join us then as we celebrate PA Week. And so if you have any questions for the webinar team, my name is Sarah Keith, or you can reach out to learning-science at lecturio.com, where we are very proud to be one of Time's the world's top 25 ed tech companies. So now I want to once again thank our speakers. We appreciate you so much and this excellent information. That concludes the teaching portion today. If you would like to stick around for a demo of the Lecturio platform, I'm going to hand it over to my colleague, Dr. Goran Stefanovsky, who is going to show you a little bit more about Lecturio, maybe some of those AI tools we mentioned today. We'll see what he has in store for us. So, Dr. Stefanovsky.
Thank you very much, Dr. Keith, and good afternoon, good evening to everyone who has been attending the webinar and to everyone staying. I see, questions in the chat whether people should stay for the demo, so definitely stick around if you want to learn more about Lecturio. If you have attended our webinars in the past, you will see that you have probably most likely seen a demo, but you can stay for a refresher as well. And as my colleague Sarah pointed out, you can always reach us, in different ways to ask for a more specific demo for yourself or for your institution. What I'm going to do now in the next 10 to 15 minutes, for the interest of time, I'm going to walk you through the Lecturio platform. So we'll kind of show what the platform is about, what it consists of, and some of the things that were discussed today during the webinar. You will be able to see them and how they're embedded in the platform. At the same time, for the interest of time, we won't be able to go through Healer as well, but Healer does also hit a lot of what was already said. So I'm going to share my screen now, and you can hopefully see it. Just if I can get a verbal confirmation that you can see my screen really, and then I can start.
Yes, I can see your screen.
Yep, it says that the participants can now see it. Okay, so for those of you who haven't seen the Lecturio platform before, this is really what the platform looks like once you enter the platform, and we are currently on the learner's view, and we will get through the institutional view of what you see as a lecturer, as a professor, as an instructor from your institution. Here we would ideally have your institution's logo if you are to obtain Lecturio for your institution. Now, the platform is very intuitive on how it works. And it does contain the entire medical and the entire nursing curricula. And as you will see, if you're more interested and come to the next webinar that Dr. Keith just mentioned, you can also see the PA aspects of the platform and what it contains. Currently, we have the nursing videos here, and the platform is predominantly based on videos, but all of those videos also have concept pages that we will see in a second. So the videos are here. You can see the library. You can continue watching the video. So this is very personalized to the learner, and it's very personalized to the person using this at your institution. So you can have your own bookmarks, and you will see the question banks in a second. And as you can see, there's a lot of learning science that's embedded in the platform, and spaced repetition is just one of many concepts from health professions education that is embedded within the platform. So this is where the videos are. We can just kind of go through to see that this really does contain a lot of videos. So you can kind of choose whether you want to see this from a physician associate or nursing or all of the medical courses, clerkships, preclinical, clinical courses. So we can look at nursing just to kind of continue on the examples that were given today. So we could really choose anything, but we could go through pharmacology, for example. So you can see that this one has a lot of videos with a lot of minutes within each of the videos. But fear not, all of these videos are between 3 and 9 minutes long, just because, as you know, especially learners, but I would say all of us, our concentration is a little bit lower, isn't it? So let's say anti-infective drugs in nursing, for example, and then when you go here, you have far more videos. So let's see a penicillin in a nutshell, for example. So all the videos look in a very similar way.
In a nutshell.
Mute Rhonda for a second. So all of these videos look very similar. All of the presentations are there. So when looking and watching at these videos, you can download the materials, which in essence are the presentations of the video contained, so that you can recreate it with your students or take notes yourselves or your students. There's a transcript for people that are hard of hearing, and then there's learning objectives embedded in each of the videos. So in here, you can really see where that competency aspect is coming into play, because for all the specific particular video, you can find the learning objectives. Then this is part of the playlist that we just saw. And after every video that you or your learners have really watched, there is a quiz. I'm going to pause that for a second and see this is basically just over 2 minutes. So there is a quiz, and then the serious possible side effects, for example, and we can choose the right answer, and then you can kind of choose what level of confidence do you have when taking this question, because whether the learner takes the question and responds correctly or not, and depending how confident they are with the answer, the spaced repetition that is embedded through the platform will give this question for an active recall after a specific time. So let's say we're very, very sure that it's anaphylaxis. So this is now learned for 4 days. So on my platform here, this will pop up again after 4 days for me to see. Now, what I really love with all of these videos is, and we can go back home, is the concept pages. So each of these videos have these concept pages, and they can be foundational organ systems or tests. Let's take microbiology, for example. Let's take the fungi. And then let's take this. So all of these also follow a very, very similar pattern, right? So this is for your students to know this as a concept, to understand this as a concept. All of the videos are embedded here. And at the end, you have images that are specific. And at the end, you have references, right? So you can see when was the last time this was updated, and they do get updated a lot. You can assign this for your students so they can learn this before a class. You can listen to many podcasts. There's many shorter episodes where these topics are explained by experts, or you can even create flashcards, and these two are still in beta, but you can get them and you can see them in a more specific demo. So those are the concept pages. There is cheat sheets that are created for just sort of high yield understanding of a lot of concepts that your students might need. For example, how to read an ECG, and then you can also download this, but you can kind of just have these high yield facts of what that looks like. Now, the book matcher is here. I really do love the book matcher. So if your student is using a book, or if yourselves are using a book to learn, today we all want everything done really quickly. So you can pick your book here. Let's take the medical embryology, for example. Say we're on page 26, and then you can just click and you can find all of the videos that are kind of linking and bring explanations to what is taking place and what is going on page 26. And in case you can't find the book listed, do let us know, and we will put that book in the book matcher ASAP. Now, there's learning paths that are pre-programmed, and if your institution has this, we're more than willing to work with yourselves in your institution to create learning paths for students. So as I said, some are already pre-programmed and they can become part of the study planner, but every once in a while, we can always get new ones as needed. Patient notes are embedded, so all of the patient encounters can also be recorded as a part of a clerkship, and then this can be particular and privy to only the student or the learner, or they can even share this with you if needed. There's COVID-19 resources, and then something really important that we will get into in a second is the question bank. So during the webinar today, we did discuss the multiple choice questions and their role in the overall competency-based health professions education. Now here, you do have question banks that you can create yourselves, you can add yourselves, but there's pre-existing question banks that your students can either take to practice as practice exams, or they can use them, you can kind of hide them away, and you can use them to assess your students. So really, you can see this also in different languages as well. We can look at the nurse practitioner. You could create a custom test that kind of pulls from the already existing questions. You could go through subjects, let's say family medicine and ethics, for example. It's a custom test. You could do it in a study or exam mode, and number of questions, and you can then start the test. So they really do look very similar. So you do have a vignette depending on what kind of question bank have you chosen, and then you can have the person and the student respond this. So if you're uncertain, and I click this to be in study mode and not on exam mode, you do have an AI tutor here that can be consulted, and the AI tutor is giving you hints regarding this. So you could, I didn't even read the question, so this won't most likely be wrong, but you could submit your answer and show explanation. It is incorrect. So it gives you the correct answer, but it does explain the other answers or the other distractors and why they're not the right one. The student is able to take notes during this. They can flag the question in case something is wrong, calculator for any statistic questions, and feedback is embedded as well. So they can take this, as I said, You could test, you can pause or you can remain and test. So your students can basically take this and look at these questions to practice, but we can also end the test for the time being because I would like to take you into our AI tools. So this is what your learner, as I said, is seeing. What's really important is the administrative part, because the administrative part is what you as educators are really learning. So here, there is the AI tools, which we will dive to in a second, but you can also see the platform usage, the activity, which can go by group, by test, by user, or by all users within your cohort. Then you can see lots and lots of statistics. So if you want to see if any of your learners are at risk, if you want to see how many of the videos or the tests, the Q banks you've assigned, people have watched or engaged with, this is where you get that done, right? So this is a really good automated way, digital way to kind of follow your students throughout. And you can really see how many, in the Q bank performance were correct with AI tutor, how many were incorrect, how many were partially correct, but with AI tutor, and you can see your potentially at-risk learners. So long term, this is a very unique opportunity to follow your students in a way that 10, 15 years ago, when I was a student, we really couldn't be followed. So if you have at-risk students or students at peril of failing, you now can see who they are and you can personalize this education for them in such a way that you can be helpful to them. You can see the active assignments and the status of all of those assignments, and obviously you can use this as a flipped classroom. Now, within the AI tools, there's a lesson plan generator, as Dr. Keith already mentioned. There's the question generator, and in beta testing, we have AI Educator Assistant. Let's see the lesson plan generator for a second. So you know that planning a lesson is usually a very time-consuming process. So sometimes it is easier if we have a help of someone who could maybe play the role of an administrative assistant or anyone else who can help us with. Let's say the topic is pharmacology, as we already started with that, antibiotics. That's not how you rate it, but it's okay. Then you can pick your audience. It can be generic, PA, MP, RN. Let's say it's RN. The delivery method could be blended. The duration of this course is 1 hour, for example, and it's in English. Then you define the objectives for this course, and it's very easy once you create the learning objectives to actually generate a lesson plan. Sometimes it takes a second because it is using a lot of computational capacity. So we have the topic, we have the audience. There it is. So these are AI written learning objectives, and you're obviously more than welcome to add new ones or change these. For the sake of time, I'm going to say these are great, and then you can generate a lesson plan here. And once you do, you're obviously more than able to change it, but this is a way to help you as educators save a lot of time so that in the end, you are able to be there for your students and to do a lot of bedside teaching as well. So there is the learning objectives, key content and concepts. You can see the lesson structure and activities because we picked an hour. So this is, you can see the videos that will help with this. You can assign them, remove the videos or change them, change where the students get them and watch them and where. You can save this, download this, you can really engage with it and do whatever. And for the sake of time today, I'm just going to show you the question generator, which is really, really important. We do have a workshop about the usage of the question generator where you yourselves can try it. So keep a look an eye for that. So you could pick your exam type, your subject. Let's say we started with pharmacology, we're sticking to it. The system could be immune, and you have the domain here. So you could assess, diagnose, evaluate, or plan. Let's do plan. It does give you an example of what this might look like, but you also have the capacity to generate prompts. So let's say, because this is immune, let's do autoimmune treatment, pharmacological, female. That should be enough. So you could create a lot of questions. We're just going to create one, and you can choose the level of difficulty. So the better your prompt, obviously, the better the question. You can choose to add explanation to answer options, and you can generate a prompt. So initially, you're seeing the prompt, right? So you can move this and write whatever you want. I will just add, for example, add explanations to distractors, just in case sometimes it doesn't, and we can generate the question, and then you can obviously change this. So it is scientifically proven by learning science that one of the most time-consuming aspects of assessment is actually creating multiple choice questions that are compelling and that have compelling distractors. So this is the pharmacological management. So we already have a question with given distractors. I should have, paid a better attention to the prompt itself because it doesn't really explain the distractors. But if I were to write that in the upper section as well, it would have gotten us there. And I'm not going to save this. The educator assistant is here. So you could really see explanations, curated resources, intelligent lesson planning assistant here. So this is like having an administrative assistant, and you can really see where the sources for it are. So whether it's Lecturio or even PubMed, right? So you can find this to be evidence-based. When you use Lecturio, you know that there's not a lot of hallucinations or no hallucinations because this is pulling everything from the platform. Or you could use PubMed if you want this to be evidence-based with the latest with the latest data and with the latest evidence. So something that I forgot to show you, but I will just go back to content view, is something that your learners can also use, and it's AI. It's the AI assistant here. So if you don't have a lot of time to search for something within the platform, you can come to this AI assistant and I don't know, right? Dermatology, I don't know, a disease or something. And then you can just click here and you can find all of the lessons, all of the quizzes, all of the courses and the concept pages that talk about what I just wrote. So this is almost like a very advanced Google search where this is pulling everything from the platform and you can focus on one thing or another. So in a nutshell, really quickly, that is our platform, one of the few. And please do not hesitate to reach out to us if you want a more specific demo for your institution, and if you want to be able to try this yourself, to play around and get to see the platform. I want to thank you for your attention. Thank you for sticking with us until the end. And I will just hand over the baton to Dr. Keith now to close us off. Thank you.
Excellent. Thanks so much for that. Thanks for showing us those tools. I appreciate those of you who stuck around. If you need any more information, we'll put a link in the chat for you. And please reach out. We'd love to talk to you some more about Lecturio and how we can help you be a better faculty member and educator. So thank you for those of you who joined us today. We appreciate your time, and we hope to see you at our next webinar.